On a kind of dark, dreary kind of day, kind of a fallish kind of day outside.
Yeah.
And we have Jennifer Fallert here from HSHS, and she's a physical therapy assistant. I'm looking at her name badge here. Nice to have you here, Jennifer.
Well, it's glad to be here.
All right, you're going to talk about some interesting stuff. Brian Dust, you may like this. They're going to be...
I will.
They're going to work over people in the water. This is
Really?
pretty cool.
Yeah, that's what I
tell us
do.
a little bit about it. That's right. You work in the swimming pool at the Workman Center, I guess.
Yes, I do. I'm in there every day, Monday, Wednesday, and Friday. I start in the mornings, and I work from about 10 until 4:30 in the afternoon. Tuesdays, Thursdays, I'm in the pool from 1 to 4:30. So
It's pretty cool.
yeah, every day. I love it.
I work in a swimming pool. How
That's
cool is
right.
that? Generally, do you work like... You have patients probably all day doing this in the pool.
Yes,
You're pretty
I do.
booked up, I guess.
My appointments are about 30 minutes apart.
Mm-hmm.
Some of them I range anywhere from 30 minutes to 60 minutes. Just depends on the patient and what their needs are. So we kind of stagger that, and it's a patient-by-patient need. But most of the time it's about a 30-minute appointment, and it's all one-on-one.
All right. And I asked her off air, I said, do you need to know how to swim?
And no, you do not.
No.
You do not have to know how to
But
swim.
do you know how to swim?
Yes.
Okay, just in case.
Yes.
In case the
yes.
need arises.
And there's always a lifeguard.
Okay, so somebody's there to do that.
We can throw you a life preserver.
Okay, in between patients, do you ever just, do the backstroke, go in and swim back and forth?
I got to do my documentation. My boss might frown upon that.
Okay, tell Tammy to get over it. I got to swim. I got to enjoy myself.
Yeah.
But anyway, okay, so I can see where water could be very good to do physical therapy in. What kind of pain and stuff can we take care of in there?
So today I'm going to talk about back pain. Last time I was here, I just talked about aquatics in general and all of the different diagnosis that I treat. But today I'm going to talk about back pain.
Okay.
I can treat acute back pain, chronic back pain, and post-surgical back pain. Post-surgical back pain, usually it requires the doctor release 6 to 8 weeks after surgery. And we want to make sure there's no infection or, that the incision is closed and that you can get in the pool. So once doc gives us the okay, then we just get you in the pool.
All right, so you got back pain this is very interesting. Why do it in the water? What's the difference between working on back pain not in the water and in the water?
Right. So there's lots of benefits of being in the pool. The main benefit for back pain patients is the spinal deweighting. So the buoyancy or that upward thrust of the water that you feel when you get in will reduce the gravitational pull on the joints of the body, mostly the back, knees, and ankles, and all of those, pertinent things for walking.
Yeah.
That hurts a lot whenever you've got pain like that.
It also, the temperature of our water is 90 degrees, so it's pretty warm when you get in. So that will increase the mobility of your tissues and flexibility. So we can do a lot of stretching and things like that in the water that's going to be helpful with that increased temperature. It's also going to the hydrostatic pressure of the water. So that's the pressure that the water puts on your body when you get into the pool. That's going to help decrease any swelling. So if it's an acute case, it's going to help decrease any swelling that you might have in the lower extremities or any leg pain or just on the body in general. And then it will also increase your blood flow circulation.
Okay.
So your venous return, so that you can get more blood flow to those areas so that they can start healing.
That's right. The blood does a great thing. I mean, all this different stuff. You got to have good blood flow to help in the healing process.
Yes.
All right. Very good. Well, this is very. How did you get him? How did you get involved in doing this in water? This is very interesting.
So, I started out, once I graduated from school, I had started out at a doctor's office here in town. They had a small tank pool.
Okay.
For a while then, I worked in Mattoon at a nursing home there and did some long-term care.
They did the same thing?
I did not do aquatics.
You didn't do the aquatics
So then when there was a position that came open in Effingham and there wasn't anybody that was really doing aquatics or that really wanted to really get into it, I was hired for that position. I went and got certified, and here I am.
And there you are. And you wouldn't want to do it any other way, right?
Right.
This is awesome. You see,
I love it.
I guess you can see a lot of how it works on people, I guess it makes you want to come back and do it
absolutely.
more.
This afternoon I had a fella that got in the pool. He had a rating of about 8 out of 10 pain on land. He got in the water and he was down to a 2 just getting in the pool.
Just to get in there. And then, then you start working on it.
The benefit of that is then we can do some exercises that he can do in the pool, aided by the water and resisted by the water, to increase some strengthening that he can't do on land, because gravitational pull, gives a lot of pressing down on the body, and it makes it a lot harder to do things.
William Shatner went to outer space. That's to be the only thing that'd be better. If you got up to outer space where there's no gravity.
Right.
That would you sign up for that if we could get you a spaceship to go up there?
Why not?
I'd go.
I'll do anything once.
That'd be awesome. I mean, if Captain Kirk could go up there, anybody
that
can.
Landing looked a little rough, but whatever.
It's all good.
All right.
Well, this is very interesting, and they've come up. How long have they been doing around the world? Have been doing aquatics training like this?
Oh my gosh, for a long time.
Really a long time. Huh?
It's many, many, many years.
And it's good to know that we have a place here in town where if you are that kind of hurt, you can come and get taken care of.
Is there an age group, or is it like everything?
Nope. We treat really, really little ones. Mm-hmm. And I have had, I think my oldest has been 100 or 101.
Oh, really?
In the pool, yeah.
Wow.
So I've had some interesting cases and have seen a lot of good results from being in the pool.
It's very good.
You mentioned one of those categories, I think the 3 categories or whatever at the beginning was like post-surgery back pain. What would that be? Like operating on your back and after that, or? So
if someone has a fusion, or they have like a laminectomy, or they have something removed from the back, or they have like the cage, sometimes they'll do a cage for a fusion, things like that. Any of those post-surgical things, those are all when they have a lot of increased pain and they're a discectomy or anything like that. Anything surgical. If land is painful for them, then we can get them in the water.
I could see where that would be a nice thing after back surgery. It takes a while to get over that.
Yeah.
Yes.
And that would be cool. Very nice. All right. What kind of equipment is needed to treat back pain patients in the water?
So I can do anything from no equipment at all to just a walking program to I have neck floats. I use noodles. I have belts and cuffs and weights. I can float somebody on their back and suspend them in the water, and then basically I can do lots of different strengthening things. Core strengthening, I can do leg strengthening, arm strengthening. You can use the water, to help promote strengthening. You can do stretching. If I can get somebody on their back and they have a thoracic issue or a cervical neck issue, I can pretty much be able to do lots of things and use the water to be able to stretch or strengthen as far as, their neck, their mid-back, their arms, their legs. I can even have them reach out of the water, and then that rotation that they get, that'll help strengthen core. So
awesome.
There's lots of different possibilities.
And I guess do you use this one so they can get to stronger and healthier, so they can do these exercises out of the water?
Yes. So a lot of times there'll be a transition. So sometimes I'll get a patient and they'll solely be in the water, and then we'll do all of the assessments are done on land. So the initial measurements that are taken, strength measurements and range of motion measurements that are taken, are all done on land by the PT. And then they'll come over to me and I will see them for a series of appointments. And then after, 10 or so visits, they'll go back and check with the PT on land. And they'll check their strength again. And if they are stronger and they can start to do some things on land, then we'll transition and do like 1 time a week in the pool and 1 time a week on land, to transitioning to where maybe they do a home exercise program, because you can get a membership at the Workman Complex.
That's right.
And you can it's the same, facilities that I'm using and the same equipment that they can get to use there. So they get a membership.
Do it on their own
they
after
can
a while.
continue then in the pool on their own and then transition over to totally on land and then eventually work towards discharge.
That is awesome.
Neat.
Very neat.
Yeah.
All right. I guess the step is you need to talk to your family doctor and stuff, and they'll know where to send you and stuff for this. It's at the Workman Center. And if you want more information about this, how's the best way to find out?
So you can give us a call. We are located at the Workman Sports Complex, and that's at 1301 North Maple Street here in Effingham. And you can give us a call at 217-347-1243.
All right. And I guess you have probably patients from all over the area, don't you?
I do, yeah. There is not another, certified aquatic therapist south of Champaign.
Oh, very good.
Yeah.
So you're it.
Yep.
Well, all right. That keeps you busy, I guess.
Yes, it does.
And you do not need to apply sunscreen, is that correct?
Correct. You can if you want to.
But to get the full effect, right?
Right,
Yeah.
right.
And get like a Mai Tai, a little
Oh,
umbrella drink and stuff.
No.
That
If
would
you're
be
going to
awesome.
have one of those, bring me one too.
Okay, all right. Got to share. All right, very
Yes.
good. Well, Jennifer, great to have you here, and thank you for coming in. And we'll talk to you again.
Thanks for having us.
All right, very nice. There you go, Brian Dust. You can work out in the pool, wherever you want to.
Sounds good to me.
Awesome. I'll talk to you in a bit.
Yep.
Oh, you're gonna take me home,